Do you like ACDFs better or do you like TLIFs better?
Yeah, so there's probably three major, roles of my job. One, with physician assistant, really met all of those criteria, and then
For someone as a new grad who wants to get into neurosurgery,
Mhm.
like what are your things that you recommend?
Yeah, probably the answer for both of those would be
Yeah.
better networking.
Welcome to another episode of the Stat Podcast, and today we have a special guest, first PA on the show. Truly an honor to have my preceptor, Thomas Allen. He is a neurosurgery PA working at Neurological and Spine Institute in Savannah, Georgia. I was with him for 5 weeks. I learned everything about his role, from counseling preoperatively and postoperatively, making the surgeon's job much easier and much faster and much efficient. Intraoperatively, he was always guiding me on proper sterile technique and showing me how to actually do proper wound closures, whether it's for transforaminal interbody fusions or anterior cervical discectomy with fusions. I observed a wide variety of surgeries, but I learned some important things during my rotation that made me necessary to ask him to sit down and chat about what neurosurgery is all about. Expect to learn about how it feels like to be in a surgical subspecialty straight out of PA school. I think that's an incredible undertaking, and I hope this podcast episode is valuable to current PA students, to future PAs, and most importantly, pre-PAs who are just coming into this game.
Hey everyone, welcome back to another episode. And today we have my preceptor, Thomas Allen. So I am really excited to have you on today because I've learned a lot in the past 5 weeks about actually in-depth differential diagnosis of back pain and everything that goes related to neurological complaints to other complaints. And so one of the things that I have started to think about is you, as someone who started immediately in neurosurgery after PA school, how do you explain your journey, like coming out of PA school and going straight into neurosurgery? Like, how did that journey look like for you?
Yeah, absolutely. So I knew I always wanted to do something medicine-wise throughout most of my adult life, and I think finding a career where you have an opportunity to work as a team, and then also an opportunity to continually grow and learn, that was pretty important to me. So really, I was looking for a field where I could do that. Physician assistant really met all of those criteria, and then more specifically, looking into neurosurgery. Some of that was based on job availability, and then once I got the job and accepted the position, there's a big learning curve.
Yeah.
This is there's a little bit more intensive portion going into these subspecialties as opposed to a more generalized medicine. And so probably the first 2 years, if this can be of any encouragement to new grads or recent grads, there's probably going to be about a 2-year period or so where you're really learning. You're doing a lot of on-the-job training. You're taking what you have, all of your book learning, and then you're applying it and really learning the kind of more crucial parts of what you need to know, what's more theoretical knowledge, and then what is actually applied knowledge. So it was not an overnight thing by any means whatsoever.
So for someone as a new grad who wants to get into neurosurgery, like what are your things that you recommend as a PA?
Yeah, if possible, I would do a rotation in either neurology, neurosurgery, maybe orthopedic surgery if your program offers it. I think South University obviously does have a neurosurgery rotation now, so I'd highly encourage that. And also either talking to or shadowing one of those specialties can really shed some light as to this. Is this something that you want to do, or is it something that maybe you're just kind of interested in and want to learn a little bit more about?
Yeah. Can you speak more about the training specifically for neurosurgery? I know you got trained by the PA who worked here before, and what are some expectations your attending has from you as a new grad? I know it's like really difficult as a new grad being in neurosurgery to really fit in that role. So could you share more about that?
Yeah, so there's probably three major roles of my job. One, which is kind of the most simple, is you're in the clinic. So you're seeing patients, someone comes in with back pain, so you have to work them up. And, that's where a lot of your differential diagnosis comes into play. That's where you're going to be looking at the x-rays, looking at CT scans, MRI scans, reviewing charts, looking at, what their primary doctor or their pain doctor sent them over here for. And so that's a lot more of the, thinking about it, looking at what we have, what do we need? Is this person a surgical candidate? Are they not a surgical candidate? So it's just a lot of information processing. The second portion is the inpatient rounding. And so these are people who stay in the hospital, sometimes just overnight because they had an elective surgery and you go see them the following morning for a post-op visit. Sometimes, because we have the trauma hospital here, there are traumas that we have seen on call. And so we'll have to go in and that's usually a bit more of an acute situation where the information coming in, you got to process it pretty quick, decide what needs to be done, image-wise, lab-wise, and you kind of quickly do things on an inpatient basis. And then the third, major portion of my job, which I think is the most exciting, is the OR portion. So this is going to be very much the hands-on procedures. As a PA, you'll be a first assist to the surgeon. So you're on one side, they're on the other. You're helping really with whatever the case needs to be. Sometimes it's as simple as retracting. It can be cautery. It can be the closing. It can be assisting with the exposure. So really, whatever the case, requires, you're that extra set of hands. And I think if I compare what I do now versus what I did, 2 months into this, it's drastically different. As a recent graduate, you're going to be a little guarded, and not a little unsure as to what you're doing. But after you see the cases, 10, 20, 100 times, you start to really understand the rhythm, what needs to be done, what you're looking for. And I think you can really have this opportunity to really be an assistant to your primary surgeon and really try to increase the the speed of the case, the safety of the case, patient outcomes. So really, highly encourage anyone who likes to do the hands-on stuff to look into some type of surgical subspecialty.
Yeah. So how long does it take to actually take the pants, apply to jobs, and actually start the job?
Yeah, it's a good question. It's a really good question. I think my case, if I use myself as an example, I'm not the best example. I'm probably not the average.
Yeah.
So I won't get into all of that. But my wife and I had moved. We're in the process of moving back here from South Carolina. So I actually had already applied and gotten the position here contingent on me passing the pants. When I realized it's not quite the typical. Usually, I would say people will be graduating towards the beginning of the year, take a month or two off, study, take the pants, and then job after that. Mine was a little flip-flopped. Most of the students that I talk to really start ramping up job searching, job applying, maybe 4 or so months prior to graduation. They'll start to get some interviews in the specialties or the practices that they really enjoy and want to go into. Start setting that up, take the pants, and then shortly after that, could theoretically start working. So once you graduate, after that, take the pants, and then after that, you get hired. And then there's still a credentialing and privileging process that has to go on. 1, with the hospitals, if you work in a hospital, and then 2, with all the insurance companies, so that when you see a patient, you can actually, 1, get paid for the services that you provide, and then 2, order the imaging and they'll approve it, because you're a certified provider. So there, even after you get hired and you get the C after your name, there's still even more paperwork that is has to be done before you're fully 100% ready to go.
You just got to be patient, I guess.
Exactly. Yeah.
It's like when I think of graduating, I'm like, I'm going to graduate, I'm going to get that job, I'm going to start working. But it doesn't work like that. But we have talked about your interest in cardiology before, and could you tell us about how, like, why you liked cardiology, and then why uh, now you're in neurosurgery?
Mhm.
Like, what made you stick with neurosurgery more than cardiology, going through that rotation at St. Joe's
Yeah, no,
as a PA
absolutely.
student?
Yeah, no, I think
Mhm.
in PA school, I enjoyed studying cardiology. A lot of it made sense to me.
Yeah.
I liked the people that I did the rotation with.
Mhm.
Overall, it was just a really positive experience, and that's what I had initially looked into. And
Mhm.
then I ended up going a slightly different route. Although I will say, looking back, like now going into a surgery subspecialty like that is absolutely what I enjoy doing. I think there's no doubt that in my
Yeah.
mind now. I think it's very exciting,
Mhm.
and then I think you can really see some very real and very immediate changes in patients who really do need a surgery, and
Mhm.
then even a few hours after surgery, sometimes immediately post-op, there's improvement.
Mhm.
And so, I think that's very gratifying,
Yeah.
and I think I find a lot of satisfaction in my
Mhm.
work.
Okay. And so for someone like me, I have a lot of, I when I was an undergrad, I took neuroscience,
Mhm.
and when I started this rotation, I thought I have a good grasp on the history and physical, but then somewhere, like, even after 5 weeks, I feel like I'm still not
Mhm.
there yet, even though I have a lot of this back knowledge and experience of anatomy and physiology. So what would you say, like, some of the things as PA students, they could improve on during their clinical year if they want to get into neurosurgery, from the clinic days to the OR days? I know,
Mhm.
like, in OR, we really have to know how to do uh, different types of suturing and
Mhm.
hand tying, but in terms of skills regarding PA students, like what
Mhm.
we can control right now, what are some of the things that we should work on?
Yeah, probably the simplest thing would be if you are looking to go into some type of surgery subspecialty,
Mhm.
would be practicing your suturing.
Yeah.
So the suturing, the instrument ties, the hand ties, just being familiar with that. That's, as far as the OR portion, that's probably the simplest and the one you could do at home.
Mhm.
For the more of the clinic history and physical portion, I think it's going to be more experience more than anything. You have to
Mhm.
talk to patients. You have to, hear their, concerns, and then you have to see these diagnoses, not just one time, but 10, 20,
Mhm.
again, like 100 times, and then you'll really start to understand, kind of the presentation, how you should treat this, what you're looking for on imaging. And so I think a lot of it is exposure. So I wouldn't
Mhm.
really expect someone, even after 5 weeks, to really have much of a grasp. I mean, when
Okay.
I started, again, it was probably about 2 years
Okay.
before I was really comfortable, and had at least a reasonable grasp of, the common diagnoses, kind of our treatment plan, and was able to do a lot of that with pretty minimal assistance.
Feels like someone has to have a skill set repeated for a long period of time to actually be
I
confident.
think so. Yeah, I think the statistic is you need about 10,000 hours worth of work before you are pretty competent in an
Okay.
area. It's a
Yeah.
long time.
That's
Yeah.
amazing how those personal productivity concepts come together for
Hmm.
PA students and generally, like, being in surgery.
Absolutely.
Yeah.
Yeah.
What are some of the things that you do in terms of making yourself learn faster? Because I feel like a subspecialty like this, like, you really have to learn a lot of
Hmm.
things really fast and to keep up.
Yeah, I think reading.
Yeah.
An avid reader, so it's not too
Hmm.
much of an issue for me. But the reading, and then a lot of the call scheduling. We take the trauma call, and it can be intensive hour wise at first.
Hmm.
But honestly, I think it's a good thing.
Hmm.
Because when you're exposed to something every single day, you're going to learn it faster than if you see it once a week. And so again, you're accruing those hours much faster into that experience, seeing not identical patients but similar patients, where you can start to really form patterns. The treatment plan, how to work them up, and so doing it again and again and again and again and then again,
Yeah.
you see these common patterns. And then even to something as simple as looking at x-rays. You don't know what an abnormal x-ray is until you know what a normal x-ray is. So you have to see tons of normal looking x-rays, and then when you're looking at an x-ray and you see something different, you're like, oh, that's different. And so, this may warrant some further investigation. So again, a lot of it is exposure and time.
Okay. Yeah. Like right now, even having 5 weeks of this rotation, I feel like I could read x-rays a little bit better than when I started. Definitely not 100%. And same with MRI, and same with like when we talk about like, let's say we're talking about myelograms and different types of imaging modalities. It's still so different compared to didactic, because in didactic we just learn about the most basic imaging and maybe some other imaging on top of the basic imaging, but not into detail. I think that's what, as clinical year PA student, I feel like I, for example, need more training on that and more like self-directed learning in terms of looking at different imaging. But
yeah, I will say that's really perhaps the one area when I think every student so far has wanted to spend more time on the x-rays, more time on the CT, more looking at the MRI, because it is something that as PAs we don't get a ton on. We do kind of understand what they are, but as far as specific modalities for specific body regions, it's not something that spend a ton of time on in school. It's more of when you get into that subspecialty, then you really have to put in the time and effort to understand that. But it's certainly something I know I try to spend a little extra time when y'all come through. I'm just really looking at the x-ray, CT, MRI, sometimes ultrasound.
Yeah. So some last bit of questions. What is one thing you recommend for PA students, like one piece of advice for PA students that maybe you wish you regret that they like we should have, and then one piece of advice for people who are new grads applying to jobs and trying to figure out what they want to do?
Yeah, probably the answer for both of those would be better networking.
Okay.
Kind of a lot of social networking, maybe not so much like on your phone, but really getting out, talking to people, talking to other PAs, talking to nurse practitioners, talking to the doctors. I think that those in either general practice or surgical subspecialty, they can shed a lot of light. Like, is this a lifestyle that you want? Are these the type of patients you want to deal with every day? And that's also where you find your job opportunities. So as people who are either about to graduate or have recently graduated, entering the workforce, I think it's important to have a group that you can rely on, and then even when you do start practicing, get everyone's phone number. You don't know when you're going to need the doctor who practices 4 hours away from here and has sent you a patient or two. Like one day you might have a patient, you might need to call him. And so every other practitioner's phone number that you can get, I would go ahead and get, because again, you never know when you may need to talk to them.
So don't be afraid to talk to doctors, PAs, other providers, and not be afraid to take the contact information, because I struggle with that too.
Put it in the phone, and then that way you have more people on your team.
Okay. Well, those are some great things that you shared today. Lastly, I'd like to finish out with some rapid fire questions with everyone who comes and talks to me. So my first rapid fire question is, do you like ACDFs better or do you like TLIFs better?
ACDF.
Why?
I enjoy the exposure more, and I don't know, I feel like I get to do a decent amount for those.
Yeah, those are intensive. Yeah, definitely. Second one is, just whatever comes to your mind first. Your favorite type of lentils?
Favorite type of lentils? Probably just the plain brown lentils.
Okay. Do you want to share why I asked you that question?
Oh man, it's part of the meal prep. Yeah. Cheap, high protein, delicious.
Yeah, and that's probably your nutrition advice for PA students too. Cheap, high protein, high fiber.
Absolutely.
Okay. Absolutely. Third one is, do you like those earthquake bars better or planks better?
Oh man, yeah, that's a tough workout
Great,
question.
yeah.
I would say do both.
Do
Yeah.
both. Okay.
Do both. Yeah.
Okay. I guess those are all my rapid fire questions.
Great. Sounds good.
But I really appreciate that you came on today
Mhm.
because I know you will teach a lot of lectures this year. You have coming up what spine lecture
Spine in July.
and head imaging.
Oh, maybe it's head imaging in
Head
July.
imaging.
That's right. Yeah, and then spine later
Spine
on.
later
That's right.
on. Okay.
Yeah,
Well,
that's right.
so he's going to be teaching to the South University PA program soon. So, and he taught us as well. And I really liked his lectures. And today he has been my preceptor. This is my last day. So thanks for talking to
Absolutely.
me, and thanks for talking to other people on the camera.
Absolutely.
Yeah. Bye everyone.